Well, thank you, Dr. Rao, for the kind introduction. You know, you do all the hard work. I'm just a pretty face, so yes, it's it. I just come here to talk in the conclusion, and I take the credit. No, but I'm glad. I'm very happy, and it's a privilege to stand in front of all of you guys because I see the future of the valley here. As Dr. Rao mentioned, maybe 10 years ago, 10 and a half years ago, I came here just on a whim. I didn't know anything existed below Dallas. I was in Baltimore, Cleveland, the typical up northeast. But when I came here, and I never left, because this is the place, this is the future of the country, if not the world. And you guys are the future of this country. But I always ask this question, and I'm still in a clinical practice, and I don't know if you guys have mic, I can ask question, otherwise I'll answer that. Do you know people who are from the valley, if they have a healthcare need, they would rather go to Houston than stay here and look if it is available here or not? And I used to ask them a question, you want to go to Houston, but where and why? Do you know any physician? Do you know any specific clinic? No, I'm just going to Houston. So I used to wonder why. What is this in that I'm going to go to Houston? What gives them that confidence, that comfort that they will get the right treatment in Houston and not in the valley? And that is the question for all of you guys. What does Houston name bring that valley does not bring? And what are the things we can do to make that change? Number one, I think, is the good healthcare system, right? And number two, they do research. So what is a good healthcare system? Is it a good building, fancy building with a great parking, with a nice food, nice room with a nice channel, TV channel in the room? No. Yes, that's important too, yes. But most importantly, other than that, the healthcare workers. When we think of hospital, we only think of physicians, maybe nurses, but we don't know there are allied health practitioners, there are pharmacists, there are so many people who are in the hospital that makes the hospital or the healthcare system what it is, what it makes it Houston. So why can't we do that? Why can't we bring and raise our level to that healthcare system like anywhere else where people say, I don't have to go there, I'll just have to go to a place like, which is written here, DHR. I'm a little biased towards DHR, but every health system is here and that's what we need. The second thing I would like to point out is it was almost 2 years since that pandemic started, and almost everybody in this room has been affected directly or indirectly with that pandemic. A lot of lives were lost, a lot of morbidity, but we are almost, thankfully we are over it. Dr. Rao might disagree, but I think we are almost over it. We are ready to call it quits. But that pandemic was a watershed line for the healthcare industry, for the rest of for the country, definitely for the valley. It exposed what we have been hiding and we have been ignoring in the valley is health and healthcare to the people, both. And everybody knows now we need to learn from this crisis so that when the next crisis comes, we are ready. But we could have been worse. We could have done even worse than what we did if we did not have the infrastructure what we had. And when we talk about health infrastructure, a good healthcare system, hospital, physicians, wonderful nurses, and everybody in the hospital who went above and beyond to take care of people in the community. But more importantly, which was not there before, and he's very modest, he will never acknowledge, which was lacking in the valley was research. What makes Houston, Houston? What makes MD Anderson, MD Anderson? What makes Cleveland Clinic? And what we need to be called that place is research, the cutting edge research. And it's not something exotic which some people out there do it. No, we have the infrastructure, the people and the resources to do that. Doesn't matter what field you are in, pharmacy, healthcare, nursing, doesn't matter. Everything research has a component that makes you way better than anybody else. And we can do that. And I see that future down here. And I'm very hopeful that next time any pandemic or something comes over, we will be ready and people will start saying in San Antonio and Houston, where are you going for healthcare? We are going to the valley. And that's where we want to be. And that's why people like Dr. Rao is very important addition to the valley and to the community that is going to take us and help us. And basically, it doesn't matter. We are getting old. I don't know about Dr. Rao, but I am. You are the future. The fire which we are bringing here, the thing which we are going to start, you have to pick up that torch and carry on. And that's the future and which I'm seeing here. And I'm very, very, very hopeful that nobody has to leave Valley for a better healthcare or anything related to healthcare, because you guys are going to take that torch and run with it. So thank you very much. Thank you.